Siphinde sikwamukele mbukeli lapho ekhaya sisaqhubeka nodaba lwethu le-prostate cancer. Dr Mthombeni,
Yep.
siyazi ukuthi kubomake sinokuthi at the age of 40 kufanele bayenza mammogram, kanti laba aba-sexually active bayenza i-pap smear. Kubo babe, at what age kufanele baqale khona i-prostate screening test?
Okay, so in prostate it's a bit different in a sense ukuthi lama patient ayahluka like in terms of risk of developing the prostate cancer. So there's what we stratify them according to the risk categories. Guna average risk and high risk. So an average risk individual. So let me rather start with the high risk individual.
Yes.
A high risk individual is someone who has a strong family history of prostate cancer, meaning that if you are a man and your father had prostate cancer,
Okay.
you are a first degree relative to that person. So your chances of having that cancer are high. And then, so that group of high risk, the current recommendation is that because of other factors that can actually make the individual develop cancer at an earlier age. So it is advisable to start the screening at an earlier age. So they advise Uguti we can start from the age of 40 to 45
Okay.
for the high risk people. And then for those with average risk with no the same risk factors as I've mentioned, the current guidelines are advising that you can actually start screening from the age of 50. So what we do with screening is basically we do a blood test. We draw like the venous blood and then send it to the lab and check what we call the prostate specific antigen, which is the PSA.
Okay.
Yeah. So the PSA is produced specifically by the prostate. Okay. So when it goes high, it can be, it's not specific. There's a lot of other factors locally to the prostate and also systemic problems that can actually raise the PSA. But that's what we look at essentially. So if it's too elevated, then we are worried that something needs to be done. The patient needs to be investigated further. So what usually happens, this usually happens at the primary healthcare level or at the general practitioner level. So when the PSA is elevated, then there should be consideration of a referral to another specialist for a biopsy. So what they do, what needs to be done now is that when the PSA is high, it's usually the specialist urologist. So a urologist with doctor kidneys and the bladder.
Okay.
Yeah. So what they do is that they take a biopsy. So the biopsy, they can take it through the rectum. Meaning they use a trocar to get into the rectum. If you know the anatomy, you do get into the prostate and then take it out like that. But also there's also another approach where the person can just lie supine and then they go through the skin, the perineum, directly to get a sample of the prostate. So that sample of the prostate then it's preserved in formalin, and then we send it to a pathologist. So the anatomical pathologist, and then they put specific stains that they use, and then look at that specimen under a microscope.
Yeah.
So in that microscope, basically what they're looking at the tissue, at the cells that are there. Are the cells resembling the normal prostate or are not resembling the normal prostate? And then if they do resemble the normal prostate, are they cancerous or not? Because they don't look the same. So from there, the pathologist will then do what we call a Gleason score by using those parameters of how the cancer cells look like, and then they will come with a score to basically tell us how differentiated this cancer is. Is it more leaning on the normal side, meaning that it resembles normal tissue? Is it what we call poorly differentiated, meaning that it's more aggressive and most likely to spread? So those are the things that the pathologist should tell us about the Gleason score, whether the tumor involves the nerves around there, whether the tumor has well, if they did like an extensive surgery, if it spread to the nodes and all those things. So that's very important information for me as the oncologist to actually decide on the type of treatment I can offer these patients.
Ngaphambi kokuthi umuntu mhlawumbe decide ukuya kubodokotela ayoyenza i-screening, yiziphi impawu mhlawumbe angazizwa kuyena?
So dokotela, it's not specific. Kuyahluka kahle kahle depending on how far the cancer is. So obviously prostate, like, it starts locally. So if it's a more local disease, the more common symptoms are not specific. They can experience things like difficulty in passing urine. Like there's a blockage essentially.
Okay.
And then they can also experience things like what we call dysuria. So dysuria is basically like a burning sensation when you urinate.
Okay.
Yeah, and then they can have these other symptoms, like, so all these symptoms, we group them as what we call irritative symptoms, lower urinary tract symptoms. So the irritative symptoms, like I've mentioned, and the obstructive symptoms. So they can present like that, and then if it's advanced disease, they can present with bony pain, like I've mentioned earlier. Uguti, this cancer can spread to the bone, and it loves spreading to the bone. So they can present with unspecific bony pain without any history of a trauma or injury, because it loves going to the spine. They can present with a weakness of the legs, which is very like acute, unexplained weakness of the legs. And then also they can present with urinary incontinence, meaning, which is an opposite of what I've just said, meaning that they can't really hold the urine now, because the spine is not working. In most cases, if the cancer had spread to the spine and cause a neurological deficit there.
Kunalento ababa abaningi abayithandi ukuthi mabeye kubodokotela sibafake umuno la emuva, sibiza ukuthi PR. Akukuchaze nje ukuthi kusuke kwenziwani lapha, but asibambeke nje kancane dokotela, siye breakini, masibuya nje khona sizochubeka lapho ukuthi basuke benzana bodokotela uma befaka umuno. Siyabuya mbukeli, ungahambili ekudeni.